Hello everyone, and welcome to GI Research on the Road. This event is sponsored by the International Foundation for Gastrointestinal Disorders. Today we are speaking with Dr. Jami Kinnucan from University of Michigan and registered dietitian Patsy Catsos. We are here live from Food the Main Course Digestive Health in Ann Arbor, Michigan. Each of our participants passionately provides care for patients who suffer from functional gastrointestinal immotility disorders. Today, we're speaking with Dr. Kinnucan and GI dietitian Patsy Catsos about the overlap between irritable bowel syndrome, otherwise known as IBS, and inflammatory bowel disease, often referred to as IBD. Often, IBS can be mistaken for IBD or vice versa due to an overlap in symptoms and the commonality in demographics. Today, we will address these overlapping symptoms of IBS and IBD and understand how to distinguish between the differences of the two. So, Dr. Kinnucan, what is IBS, what is IBD, and what are the differences between the two?
Thanks, Marissa, for having me. I'm very much looking forward to sharing information with patients. It's actually a really good question. It's often the two disorders, IBS, or irritable bowel syndrome, as you said, and IBD, or inflammatory bowel disease, get confused by both the general public and patients, as well as even medical providers. They're two very different conditions, however, they do have an overlap of symptoms that they present with. Patients with IBS often will present with abdominal pain at least once a week for a 3-month period of time. This pain is often associated with either having a defecation, so having a bowel movement. It can improve pain, a change in bowel frequency, or a change in stool caliber. And while patients with inflammatory bowel disease, or IBD, can also have very similar symptoms, their disease and their symptom presentation is often accompanied by rectal bleeding, weight loss, a family history of inflammatory bowel disease, and these are things that we don't see in patients with irritable bowel syndrome. It's important that we distinguish them because they're treated very differently, and we can talk about that in a little bit. But patients with inflammatory bowel disease, some of them actually do also have an overlap of irritable bowel syndrome. So it's important, while it can be confusing because they're so similar in terms of what we call them, it's also very important that we distinguish between them.
That's wonderful to note the differences between the two and the fact that there can be an overlap and the importance of that. So to build upon that, now that you've explained those differences between IBS and IBD, what are some of the treatment options for patients who are living with IBS, and are there any new advancements in research that you know of?
Absolutely. I think this conference has been great to touch on some of the treatments that are very commonly used in patients with irritable bowel syndrome. I think the most important thing that I got from the conference was that it's a really important multidisciplinary approach to patient care. So patients are best served when they're seeing a gastroenterologist, as well as a dietitian, somebody like Patsy, as well as a GI psychologist or a behavioral health specialist, or even a therapist in the community. And all three of those providers really help care best for patients. Some of the more common treatments that we see, at least on the medical side, is that we use fiber, both in the diet as well as sometimes fiber supplementation to help patients that have underlying IBS. Some other treatments that we use include working with our dietitians to talk about how do we do dietary modifications. The most common one that I think Patsy will touch on is the low FODMAP diet, and we see significant success with that. In addition to diet modifications that Patsy will touch on in terms of the low FODMAP diet, other things that we see are different medical therapies that have been approved for patients with both diarrhea-predominant IBS or patients that have constipation-predominant IBS. Some of the advances that Dr. Che touched on during the conference talked about various elimination diets and how those might be beneficial, but only currently are being studied, as well as some various pharmacologic agents, so medications that might be used. They did touch on the use of FMT and how it has been studied and right now is not been shown to be beneficial in patients with IBS. So I think we've learned about some new things coming, but also some things that maybe haven't shown to be much benefit. Most of the focus that I've seen has been on how do we change the microbiome and how does that potentially impact patients with IBS.
That's a very good point, and topic of the microbiome is being discussed this weekend as well. So patients will be able to find videos on that and resources. So now that we've talked about IBS, can you share with us the different treatment options for IBD? And again, if there's any new research that you know coming up for that.
Absolutely. So while they have very similar overlap in symptoms that they might present with, we do treat them very differently. The pharmacology or the medications that we use to treat patients with inflammatory bowel disease really target treating an inflammatory component of the disease, whereas in irritable bowel syndrome, there isn't that aspect that we treat. So there are many FDA-approved medications that we use to treat patients with inflammatory bowel disease. There are many medications that are currently in the pipeline. What that means is that are currently being studied, and we hope to have FDA approval in the next 6 to 12 months. There are also non-medication-based things that are being studied that Patsy might touch on in terms of a Crohn's and Colitis Foundation sponsored study looking at how do we change diet in addition to medications to help patients with Crohn's disease. And we're seeing a lot more of those studies come up. So I think there's a lot to come in terms of the next year or two, studying things even outside of medications to help patients with inflammatory bowel disease as well.
That's very exciting news, and we will definitely have to be on the lookout to let patients know what is coming up and the other resources that will be available in the future. Thank you. So now we turn to you, Patsy. For someone who has been diagnosed with IBS, how might that affect their symptoms, and what type of dietary management plan could you recommend them?
Well, when I first see someone who's been referred to me for IBS, I try to do a thorough nutrition assessment. And I usually start with the basics. You know, are they eating enough fiber, enough fluids, getting enough exercise, eating meals on a regular basis? If they've already covered all those bases, which is pretty common by the time they get to see me, if they have IBS, the next step I might consider, if they are a good candidate otherwise, is a low FODMAP diet. So people who are good candidates for that diet have a firm diagnosis of IBS. They actually are consuming some FODMAPs in their usual diet, and their symptoms seem to be meal related. And they also have to be, willing and able to try a big dietary experiment. Although it is temporary, it is a bit of a project, and it's one that people have to be up for, and they also have to be a safe candidate for it. For example, people who are at risk for eating disorders are not considered good candidates for an elimination diet.
That's a very good point, and I like that you brought up that it is a short-term diet. So although it may be a difficult diet, it's helpful to work with your dietitian, and the fact that it is short-term to help figure out what is good for you, I think is promising to patients.
It's definitely more than a list of high and low FODMAP foods. You need a strategy and a plan to get the most out of the process, and that's what your dietitian can provide.
Yes, and FODMAP is a big topic this weekend for the food course, so hopefully patients will tune in to find more information about that as well. So now that we talked about IBS, for IBD, what might you recommend for those patients to help manage their symptoms?
That's a little bit less clear at this time. Because I do work with FODMAPs so much, I often, at a minimum, have a look at the IBD patient's diet to see if they are consuming excess FODMAPs. But a low FODMAP diet is not considered able to induce remission or be anti-inflammatory for patients with IBD. On the other hand, it can still help manage symptoms to some extent. So if the IBD patient with an active flare is consuming too much FODMAPs in the form of fluids, for example. Maybe they have a lot of diarrhea and they're trying to replace fluids with juices or soft drinks or milk. We can help adjust that with FODMAPs in mind. But if a patient with IBD is in remission, but they still have IBS-like symptoms, which is very common, then we might try a low FODMAP diet in that case. There are also some really interesting diets of various kinds in the pipeline that are being studied to help actually reduce inflammation and induce remission in patients with IBD. For example, the study that you referred to earlier that's comparing a couple of the more prominent dietary ideas, and also the Crohn's disease exclusion diet in combination with partial enteral nutrition. So I think within the next few years we're going to see a lot more dietary treatments for IBD.
That is great to look forward to, because I'm sure our IBS and IBD patients are really looking forward to having other options available to them. So we will absolutely have to keep an eye, like you've both discussed, on the pipeline to see what's coming up. So again, on the topic of diets and upcoming diets, some diets have become more popular than others with the increasing use of social media among all ages. So what are some diets that research supports to be most effective as opposed to ones that someone with IBS or IBD should steer clear from?
So with regard to diets for IBS, low FODMAP diet really has far and away the most evidence to support its effectiveness for patients with IBS. But if a patient comes to me and tells me that another diet idea really helps them manage their symptoms, I am really unlikely to try to talk them out of it because I'm for what works. And we know that FODMAPs aren't the only thing. Food's complicated, so there can be many other aspects of or components in food that could be an IBS trigger for someone. And so I don't usually call out any other specific diets as unworthy of consideration, but I do recommend that people consider the source when they're looking at diet information on the internet, and really try to keep their diet as broad as possible. Try to not spend too much time collecting multiple restrictions from various sources, and to try to avoid diets that seem over-restrictive or that don't have an end game, no plan to reintroduce or be experimental to see what foods can be reintroduced successfully.
Those are very good points you have there. I think a lot of patients don't realize that a lot of these diet plans are with the point of reintroduction being in the future.
Mm-hmm.
And I really like that you said you can't roll out one diet in general. I think that really calls the importance of talking with a dietitian for these diets, because you don't know what may or may not work for you based off a pamphlet or what you see online. The importance of really working together to doing what's best for each individual. So thank you. So we are here at day 2 of Food the Main Course to Digestive Health in Ann Arbor, and you were the second speakers yesterday. So what topics are you looking forward to that are also being discussed this weekend?
I think just, I think it's a great course organized around each disease state. I like that it's, a medical side to it, and then looking at the dietary side. I know that from my standpoint, I learned a lot from our dietary speakers yesterday. And so I'm very much looking forward to seeing, what else in other disease states, especially because there's so much overlap with some other conditions that can affect patients with IBD, in particular IBS, as well as celiac disease and different esophageal disorders and other functional disorders, and how, I as a medical professional can better help them, and also how I can better partner with my dietary colleagues to make sure that, we're helping patients the best we can.
And one of the talks that I was looking forward to the most, and that turned out to be awesome, was a talk today about how pelvic floor therapy can be helpful to patients with IBS and other GI conditions. The physical therapist went through, all the nuts and bolts of the work she does to evaluate and treat various pelvic floor conditions, and that was fascinating.
Yes, definitely some very great information that you don't always hear, and is extremely important to the patients. So thank you both, and we at IFFGD are also looking forward to all the talks this weekend and looking to update you, the patients, on what cool ideas and what other topics are being discussed now in the GI community. So thank you everyone who tuned in today for today's GI Research on the Road, and many thanks to both our participants here, Dr. Kinnucan and GI specialist dietitian Patsy Catsos, for taking the time to talk with us about the overlap between IBS and IBD, and we are very grateful for you to share your unique insights with us today.
Thanks for having me.
Yes, thanks a lot.